the question here is the pathology shown in the figure depicts. So what we are seeing over here is there was a laceration in the blood vessel and there is bleeding that has occurred. After that, over here, if you see, there is a mesh-like structure that has been formed. However, there is still bleeding that is continuing to occur because there is an inability to form a clot. So that means there is an increase in the clotting time and there is no definitive clot that is formed. So amongst the given options over here, the right answer would be hemophilia. So why is it hemophilia? As we all know, hemophilia is a disorder of the clotting factors in the sense that there is, so if we have to talk about the basic normal coagulation pathway, coagulation means how the blood is, there is stoppage of bleeding. So coagulation pathway, if you have to think about it, there is a rupture of the blood vessel. Once the blood vessel is ruptured, there is bleeding that occurs from there. After that, the first most important thing is that the blood vessel contracts. Once the blood vessel contracts a little, there is a decrease in the space that has been formed in order to bleed, for the blood to ooze out. So that is that is the first mechanism. The second most important thing is the platelets are recruited to the site of bleeding and they try to just attach themselves over there. So this is what is called as platelet plug formation. So the platelet plug formation is an assessment of bleeding time. Okay. So once the platelet have plugged over there, they undergo contraction a little and that is called clot, that they undergo contraction and they release factors. In addition to that, the blood vessels also have factors present in them. That is, the endothelium of the blood vessels have factors present in them that help in clotting. So after the platelets have reached over there, then you have the clotting factors that come into picture and they cause the coagulation cascade in that particular format and they help in stoppage of bleeding by forming a clot. So in So these coagulation factors are responsible for what is called as clotting time. Okay. So hemophilia is a disease. It is an X-linked disease in the sense that males are the most commonly affected. It was also called as disease of kings. The, the main reason why it was called disease of kings was there was a king who was affected by this disease and he was continuously bleeding and he bled to death. So that is why it is in such patients, it is very important to remember that all routine procedures that we carry out, such as scaling and root cleaning, we first have to assess the amount of clotting factors that is present over here or the degree of hemophilia that is seen in the patient, and based on that we have to carry out the necessary treatment, because if there is any deficiency of a clotting factor, the amount of deficiency is first measured, and if the deficiency is high, we have to supplement from external sources these clotting factors to the patient. Okay, so hemophilia can be, this hemophilia that we see, they are of three types: A, B, C. In addition to that, you have something called as parahemophilia. Okay, so hemophilia A is due to deficiency of factor 8, hemophilia B is due to deficiency of factor 9, and hemophilia C is due to deficiency of factor 11. Parahemophilia is due to deficiency of factor 5. Okay. In addition to that, we have something called von Willebrand disease. This helps in clotting along with factor 8. So in this disease, there is deficiency of von Willebrand factor, and this also leads to bleeding. Thank you.